Today I'll be presenting a diagnostic conceptualization of Beau, the main character from the film Beau is Afraid, directed by Ari Aster. Beau is an adult male who lives alone and demonstrates significant impairment in daily functioning. Throughout the film, we follow his attempt to travel to visit his mother, but his journey becomes increasingly chaotic, threatening, and disorganized as he experiences increasingly distressing situations. It's important to note that the film is presented through Beau's subjective experience, so what we see may not be an objective reality, but rather a reflection of his internal psychological state. Um, in terms of key symptoms, Beau presents with severe and pervasive anxiety. He demonstrates consistent fear and anticipation of harm, even in situations that are considered relatively neutral. He engages in catastrophic thinking, constantly expecting the worst possible outcomes. There's also strong evidence of avoidance behaviors, such as difficulty leaving his apartment, engaging with others, and navigating the outside world. He appears hypervigilant, constantly scanning his environment for potential threats. And in addition to anxiety, Beau exhibits trauma related symptoms. His relationship with his mother appears highly controlling and emotionally damaging, suggesting potential developmental trauma. He demonstrates chronic guilt and shame and a persistent sense that he is at fault and is inherently bad. His emotional responses are intense and often dysregulated. He seems to be experiencing the world as fundamentally unsafe. There are also psychotic like features present. Beau demonstrates paranoid ideation, frequently believing that others intend to harm him. At times, his perception of reality appears significantly disordered, and some sequences suggest hallucination like experiences. However, these symptoms appear closely tied to distressing high anxiety situations and trauma rather than existing independently. Looking at differential diagnosis, generalized anxiety disorder is an important consideration given the pervasive and excessive worry paired with feeling of being constantly on edge, difficulty concentrating, and sleep disturbances. However, generalized anxiety disorder alone does not fully explain the severity of Beau's impairment and degree of reality distortion. Post-traumatic stress disorder is strongly supported. Beau demonstrates hypervigilance. He's got a persistent sense of threat. He experiences emotional dysregulation and deep internalized shame, all of which appear to be connected with early relational trauma. His symptoms are consistent with what people might consider complex or developmental trauma. Schizophrenia spectrum disorder was also considered due to the presence of paranoia and distorted reality. However, this diagnosis is less likely because Beau's symptoms are highly tied to fear-based themes, increasing in intensity with exposure to distressing events. He does not demonstrate clear negative symptoms such as flat affect or significant cognitive disorganization outside of anxiety provoking situations. Delusional disorder persecutory type was also considered but ruled out because Beau's beliefs are not organized into a single fixed delusional system. Instead, his experiences are more globally disorganized and emotionally driven. His functioning is globally impaired and his behavior is obviously maladaptive and bizarre. Additionally, Beau demonstrates strong dependent personality traits. He appears unable to function independently and shows a deep fear of separation and disapproval, particularly from his mother. These traits likely contribute to his overall level of impairment. So, based on this information, my primary diagnosis for Beau would be post-traumatic stress disorder with features consistent with more like complex developmental trauma. This is supported by his chronic sense of threat, emotional dysregulation, disordered self-concept, difficulty engaging in interpersonal relationships, and dissociative symptoms, and obviously the clear influence of early attachment experiences on his current functioning. Beau experiences classic symptoms of PTSD, including reoccurring distressing memories and dreams, flashbacks, avoidance behaviors. He's unable to recall certain details of traumatic childhood events. He's got negative beliefs about himself and a persistent negative emotional state. He experiences feelings of alienation, hypervigilance, and has an exaggerated trauma response. Um, because Beau experiences persistent and recurrent dissociative symptoms, specifically sequences of derealization in which his view of the world becomes dreamlike and distorted. A specifier of with dissociative symptoms should be noted. Um, I would also consider comorbid generalized anxiety disorder, and note the presence of dependent personality traits. In terms of cultural, ethical, and bias type considerations, I think it's important to acknowledge that the film presents an exaggerated and subjective psychological experience. As clinicians, we need to be cautious to not over pathologize without significant and objective data. There is a risk of misinterpreting trauma related symptoms as primary psychotic disorders, which could lead to inappropriate treatment. So, a trauma informed lens is essential in this case. Additionally, the DSM mentions that in certain cultural contexts, stress related to maintaining family image can magnify the effects of the traumatic experience due to feelings of shame. Um, if I were providing treatment to Beau, I would begin with establishing safety and building a strong therapeutic alliance. Psychoeducation around anxiety and trauma would be important, along with teaching coping skills such as grounding and distress tolerance. From there, I'd incorporate more trauma focused interventions such as trauma focused CBT or EMDR to help process early experiences and reduce the intensity of his fear responses. Um, Cognitive restructuring could be used to address his catastrophic thinking patterns. Um, and I would also focus on increasing his independence and functioning by building skills related to daily living, like decision making and boundary setting, particularly in relation to his mother. Gradual exposure work could help reduce his avoidance behaviors through, though this would need to be paced carefully. Finally, I would consider a referral for medication management, possibly SSRIs for anxiety and PTSD symptoms, and further assessment to see if psychiatric medication antipsychotic medication may be needed if his reality distortions persist. In summary, Beau's presentation illustrates how severe developmental trauma and chronic anxiety can shape an individual's perception of the world. While his symptoms may appear psychotic at times, a trauma-informed perspective proves to provide a more cohesive understanding of his experience.